This is the first video in a series of 3 videos on colon cancer screening and will discuss prevention. Colorectal cancer is cancer of the large intestine and rectum. Colorectal cancer is increasing all over the world. A screening test is to look for a disease when a person doesn't have symptoms. In colon cancer, like in most cancers, the cancer is usually advanced by the time the patient has symptoms. Most colorectal cancers start from precancerous lesions called polyps. Polyps are small abnormal growths arising from the lining of the large intestine and rectum. This is how a polyp looks like. And this image shows a polyp being removed during colonoscopy. This is the colonoscope, removing the polyp. Most patients with polyps do not have any symptoms. If the colon polyp is not removed, some of the polyps after many years might become colon cancer, as is shown in this image. Tests called screening tests are done to detect and remove polyps before they become cancerous. Regular screening and removal of polyps reduces the risk of colon cancer by 90%. Also, if a cancer is found, hopefully it is an early stage cancer and can be treated, improving the chance of patient survival. It is recommended that adults should begin screening for colon cancer beginning at the age of 50 years. The reason is that the incidence of colon cancer significantly increases at the age of 50. That is why screening is recommended starting from the age of 50. For colon cancer, it is advised that screening is done from the age of 50 to 75 years. Screening from the age of 76 to 85 depends on the doctor's recommendations. There are certain patients at a high risk of developing colorectal cancer. These patients might have to be screened for colon cancer at an age earlier than 50 years. These include those with a family history if first-degree relatives, meaning parents, siblings, or child, has colorectal cancer. So, if a first-degree relative had colon cancer at the age of 50, the other first-degree relatives should begin their screening 10 years earlier, that is at the age of 40. Anyone with a genetic syndrome called familial adenomatous polyposis or Lynch syndrome or hereditary non-polyposis colorectal cancer should also have screening done early. In FAP, patients develop hundreds of polyps in the colon and rectum starting from their teens. Some of these polyps may become cancerous. The average age that cancer starts in FAP is around the age of 39 years, and in Lynch syndrome, it is between the age of 40 and 60 years. The image on the left shows a colon of a patient with familial adenomatous polyposis, where hundreds of small polyps can be seen on the lining of the colon. The image on the bottom shows a colon of a patient with Lynch syndrome, where there are multiple polyps. The mutant gene in both these conditions can be passed on from the parents to a child. There's a 50% chance that the children might inherit the mutant genes. If one is aware of any member of the immediate and extended family with Lynch syndrome of familial adenomatous polyposis, they should contact their doctor regarding the risk that they might have the condition. Anyone with a history of more than 10 years of a condition called inflammatory bowel disease, where there's chronic inflammation of the colon, should also be screened early. Finally, cancer survivors who had radiation treatment over the abdomen in childhood or in adults. Anyone at a high risk of cancer should ask their doctor at what age to begin screening, what screening test should be done. Normally, the screening test will be a colonoscopy, which I will discuss later, and how often should they be tested. Other risk factors for colon cancer. Although these are people at a higher risk, it is not recommended that they be screened at an age earlier than 50. So the other risk factors are obesity when people are overweight, diabetes, long-term consumption of red meat or processed meat, temperature cooking, barbecuing, pan frying processed meat, including sausages, bacon and beef jerky, etc. Cigarette smoking, excess alcohol consumption, and finally, lack of exercise. So people in this category are at an higher risk of colon cancer. Now, is there anything one can do to protect against colon cancer? These are some of the factors that might protect the population against colon cancer. These include aspirin and other non-steroidal anti-inflammatory drugs that are used usually to relieve pain and inflammation. Studies have been done to show they reduce the incidence of colon polyps and colon cancer, but there are important side effects with this medication like gastrointestinal bleeding and heart problems. Then, adequate physical activity is important. A high fiber diet appears to be protective, and a diet rich in fruits and vegetables, particularly cruciferous vegetables that are rich in antioxidants and folate, like cauliflower, broccoli, Brussels sprouts, cabbage, might protect. Still controversial is whether folic acid, folate, calcium, vitamin D, or vitamin B6 helps to protect against colon cancer.